Hello, my name is Ian McCall, and this is a short video on some of the cases we have on Acrodermatitis enteropathica in Global Skin Atlas. Let's have a little look at this case here. This was one I submitted quite some time ago, and it shows some of the characteristic features of this condition. Note the perioral or periorificial rash. Note how dermatitic this looks. The skin's broken here, you've got crusting, you've got oozing, and quite marked oozing around the eyes as well. But as well as that, if you look elsewhere, on the foot here, there in fact has been an erosion or even a little blister there, and then this crust, sorry, this is the hand, and then this crusting. And if you look at the foot, there's in fact been a blister here, and the blister has peeled. So you might have some difficulty initially wondering what was happening with this child. And the next area that you should look is to look round the genital area and round the buttocks, because that's where you also get a very characteristic rash. Let's have a look at an example elsewhere. Look at this rash here. Let's see if we can get the larger view. Okay, not quite in focus, but look here. Here you've had erosions, you've had peeling. Look at that hyperpigmentation round the outside edge. That's another classic feature of Acrodermatitis enteropathica. Acrodermatitis enteropathica is a zinc deficiency disorder. It's usually seen in preterm infants who are born with inadequate zinc stores, or it's seen in infants when they're weaned. Generally it's when they're transferred from mother's milk to cow's milk and it doesn't have enough zinc in it. Occasionally you'll get some mother's milk that doesn't have enough zinc either, and the child will get a zinc deficiency. And initially they appear to have a very bad nappy rash, but it's a curious nappy rash. You know, look at the erosions that are there. Look at that hyperpigmentation. You just don't see that in the usual irritant dermatitis. And of course, if a child seems to have a bad nappy rash, but they've got that perioral rash as well, then I think that's when you consider it. And if you look at this particular child, look at that curious rash here as well that the child's got around the mouth and the lips. And if the child's also got a degree of failure to thrive with diarrhea, then certainly zinc deficiency has to be considered. So let's look at a couple of other examples here as well. This is probably a fair classic. Here you've got acro features. You've got the buttock type rash here as well. Note that peeling and the hyperpigmentation around the outer edges here as well, and the acro peeling here. Note the age of them. They're all 1 or less than 1. Here's another example here. Let's look at that nappy rash. You can see how extensive this looks. And the edge is very fixed as well. Look how sharp that edge is. Now, you can well understand why you might think that that's an irritant dermatitis, an irritant nappy rash. But again, there should be some sparing in the folds in here. In an irritant nappy rash, usually it doesn't get right into the occluded areas here. If it is involving the occluded areas, then normally you think about things like psoriasis or what have you. But if the child also has, let's have a little look at this. Look at these acro areas here, like a dermatitis on the hands. Look at this rash round the mouth here as well, sort of angular cheilitis. But again, there's been some erosion, some sort of crusting here, and you're seeing that sharp edge. When you see that combination, and even this image here, this is probably a good image to look at. That combination of a rash like that in this area, the hands, and the perioral rash here, and a child that's a bit thin, a bit wasting, who's had diarrhea, then zinc deficiency, and acrodermatitis enteropathica. It can be inherited as an autosomal recessive disorder as well, but as I say, usually in preterm infants, premature infants. But then sometimes it can be a little bit later before it presents, and it can present, say, as a 3-year-old like this. But again, still a similar pattern, a perioral rash, a rash on the feet with peeling, looks like a bad dermatitis there. There's the picture of the hand with some inflammation, looks like a paronychia or a peripheral process. Perhaps we can see it a little bit better in this one here. It's just, yeah. Look at the damage to the nails here as well. There's another condition called acrodermatitis of Halapuo. Usually you'll get little pustules and the like there, and you can get nail dystrophy like this as well. But they'll have these pustules, first of all, causing problems. This is zinc deficiency causing nail problems as well. So it's a bit more subtle in older children like this, and then more subtle still if it's not diagnosed until a bit later in life, where it can present just with a rash like this. Now that's a much more subtle perioral dermatitis-like picture. And it would be very difficult, I think, to make a clinical diagnosis, at least difficult for me, I can tell you, to make a clinical diagnosis of acrodermatitis enteropathica on this. This was a patient of Shabazz Januas from Pakistan, and it doesn't tell us an awful lot more about this particular patient, but the patient's age 10. Presumably they had this from an earlier age. He just mentioned some zinc-containing foods that can be useful. But these patients respond very, very quickly to some zinc supplementation. Even within a week, they'll be dramatically better when they're given some oral zinc. So that's just an example of some of the images that we have. Here's another one here. Again, look at the age 1 or less. And again, this mixture of a dermatitic type process, but involvement in the nappy areas and some acral areas as well. Sorry, this was only a 4-month-old baby. And as Namir has said here, a well-demarcated erythematous scaly dermatitis-like reaction on the thighs, legs, elbows, feet, and scalp. No similar family history. Diagnosed as acrodermatitis enteropathica, as the serum zinc was below normal, and the rash responded in a dramatic way to oral zinc therapy. If you actually do a biopsy in these, what you'll see is a sort of vacuolar change in the keratinocytes in the upper epidermis. And sometimes in severe zinc deficiency, you can get almost full thickness necrosis of the epidermis, and it peels away. And if you get a lot of vacuolation, you can get the blistering that we were talking about as well in the very first case when I showed you around the feet. And these blisters, when they occur, are often at the advancing edge of the process. You know, most clinicians might look at that and think it's a blistering impetigo, you know, a staph infection with toxin. But just this distribution of rash in the groin, round the mouth, and sometimes in these acral areas should also, in a child less than 1, especially a preterm infant, make you think of acrodermatitis enteropathica. So I think you'll agree there are some excellent images here. You should read up about this particular condition because it's quite fascinating. And it was only relatively recently that the cause of this disorder was correctly elucidated. You'll sometimes see it in adults, but it's usually people who have chronic bowel disease with malabsorption, or they're on parental feeding and they haven't been given adequate zinc. And occasionally I think it can also be seen in some patients with HIV disease. So acrodermatitis enteropathica, generally in young children, can see it in adults when there's some degree of malabsorption, but a quite fascinating disorder. Thank you very much.